Let's talk about the induction plan for a toddler with a family history of MH. Typically for toddlers undergoing general anesthesia with ET tube, we'll bring the kiddo back, we'll perform the inhalational induction, and then place the IV after the child is asleep. With a family history of MH, this is a challenge because we're unable to use the volatile anesthetics since volatile agents are a primary trigger of MH, along with succinylcholine. So in this context, you have several options. Really what we're talking about is how are we going to be able to place an IV on a patient that is not going to be cooperative. So for pre-treatment, we can give some intranasal Precedex. Typically, this is going to be 1 mic per kilo. We can also give some PO Versed. That's usually around 0.5 milligram per kilogram. The other option to keep in mind is that you can use nitrous. Remember, nitrous is not a volatile anesthetic, and so it is considered safe to use for patients with a history of MH. Obviously, you'll be doing your full machine checkout and be clearing your machine to make sure that you can use your circuit as you would with any type of MH case. But it's a very nice option to use because it will allow you to get the patient comfortable enough to be able to place the IV, and it's also very short acting. I had this case last week, and this is exactly what I did. Brought the patient back to the room, placed the mask, used nitrous to be able to place the IV. After the IV was placed, we used propofol to get the patient off to sleep, intubated the patient, and then used propofol for the duration of the procedure. So keep this in mind when you're thinking about how you're going to care for these patients with history of MH. Curious to know in the comments what you may have done differently.